Hello, my name's Dr. Megan Boyk. I'm a family medicine resident physician at the E. Blair Warner Clinic and Memorial Hospital here in South Bend. People who get COVID are well enough that they can recover at home and just have supportive care and management of symptoms. You can take anti-inflammatory medications like Tylenol, also known as acetaminophen, to treat your fever and muscle aches. Just follow the dosing instructions on the bottle. Try to take care of yourself just like you would with any other illness. Stay hydrated, eat a healthy diet, continue taking the medicines that you normally take for other health conditions that you have. If you're sick at home or if you live with someone who's sick, you should also try to separate yourself from the sick person as much as possible. They should stay in their own room, avoid sharing personal items like dishes, towels, etc. Wear a mask when you're in the same room as another person. And it's also extra important to clean and disinfect the home and the surfaces that you touch every day. If you have to go out to the doctor or the emergency room, wear a mask and call ahead if possible so they can prepare for you to come without exposing other people. These precautions should be continued until your symptoms have been gone for at least 72 hours and it has been at least 7 days since you first got sick. You've probably heard COVID can be a really serious disease, especially for folks who are older and have underlying medical conditions like diabetes, high blood pressure, asthma. This is a new virus, so we're still learning about how it works. What we do know is that it causes a really serious viral pneumonia. That means your lungs don't work as well as they should. You can have trouble bringing in enough oxygen, and this is usually when people end up in the hospital. We have to give them extra oxygen. So having COVID or any serious infection can also cause worsening of underlying medical problems that you have, like diabetes or heart disease. So that causes complications as well. For treatment right now, we unfortunately don't have a cure. We do supportive care, like I said, giving people oxygen if they're having trouble breathing, IV fluids if they're too sick to eat or drink, and medicines to manage their symptoms. There's been a lot in the news about different medicines that we're trying to treat COVID, things like remdesivir, hydroxychloroquine, azithromycin, plasma from people who have had COVID and recovered. These are all experimental therapies at this point, and we're still trying to figure out if they really work and if they're safe to use. So these medicines are mostly being used in patients who are sick enough to be in the hospital, where the risk of trying them is outweighed by the potential benefit. And because we're still working on finding a treatment and cure, the most important thing is preventing yourself from getting sick in the first place by washing your hands and distancing yourself from others. Who get COVID are well enough that they can stay at home and recover there, but of course some people are sick enough that they need to go to the hospital. If you're somebody who's at high risk of getting a severe infection, if you're over the age of 65, if you have chronic medical conditions, if you're immune compromised, you should stay in close touch with your doctor while you're sick so they can help you monitor for signs that you need to go to the hospital. Most of our major healthcare systems in the area, including Beacon, St. Joseph, and South Bend Clinic, have hotlines that you can call and get connected to a doctor or other provider who can help you decide when to go to the hospital. If you don't have a regular doctor in one of those systems, you can call 211 and they'll help you get connected with someone. Signs that you should be seen by a doctor or potentially admitted to the hospital would be shortness of breath, confusion, or chest pain. If you're so sick that you're not eating and drinking enough, if you're having so much difficulty breathing that it's hard to do your normal daily activities, or if you're so sick that you can't take care of yourself. Those are good reasons to go get checked out and potentially go to the ER. If you do have to see your doctor, go to the ER, please wear a mask. And when you go, if you're able to, call ahead so they can prepare for you to come and limit your exposure to other patients. If you're not sure, you can always call the 211 number I mentioned or your primary care doctor for help deciding what the next steps should be. strengthen your immune system is just to live a healthy lifestyle. Eat healthy foods with lots of fruits, vegetables, whole grains, exercise, preferably at home on your own right now, take medicines for your chronic conditions that you've been prescribed by your doctor, and just try to live a normal, healthy lifestyle. It's really common sense things. There's a lot of medications and supplements and things out there that claim to boost your immune system. There's not a lot of evidence behind those medications to say whether they work or they don't work. So I think the most important thing to focus on is healthy diet, exercise, and managing your chronic medical conditions. So with regards to some of the home remedies out there, like taking different doses of aspirin, vitamin C, gargling hot water I've heard about, we really don't have any evidence to say whether these are effective. As far as I've seen, there haven't been any big studies saying these work or don't work, or even whether they might do more harm than good. We really have no idea right now. There's even actually some concern that NSAIDs like ibuprofen, aspirin, or similar medicines might make the disease worse. So lots of medical organizations right now are focusing more on Tylenol for symptom management compared to aspirin and similar medications. I would say if you've heard about a home remedy and you're interested in learning more about it, your first step should be to talk to your doctor and see what they think about it, if there is any research about whether it's safe and whether it's effective before you try it. So in terms of flattening the curve, the idea is that by distancing ourselves from others, we can slow the spread of the virus in our community. The concern is that if the virus spreads very quickly through the community, which it certainly has the possibility of doing if we don't engage in social distancing, that the cases will increase so quickly that the hospitals will not be able to handle the patient load. We won't have enough doctors and nurses to take care of them. We won't have enough room in the hospitals. We won't have the supplies and the equipment that we need to appropriately care for those patients. So by flattening the curve and slowing down the spread, probably over time, the same amount of patients will actually get COVID, but it will be fewer patients at a time. And that way, that will allow the hospitals to ramp up their supply, ramp up their staffing, and make sure that we're able to take care of the patients that need to be in the hospital. Muchas gracias por escucharme y vamos a luchar juntos en contra del COVID-19.